In this video, we will be discussing about left-sided heart failure. Starting with the causes. Left-sided heart failure is most often caused by ischemic heart disease, which is caused due to reduced blood flow to the heart. High blood pressure, also known as hypertension. Aortic and mitral valve disease. We know that in the left side of heart, we have mitral valve, which allows the blood flow from the left atrium to the left ventricle, and aortic valve, which allows blood flow from the left ventricle to the aorta. So if there is any defect in this two valves, it will lead to left-sided heart failure. And primary myocardial disease. It is any condition which affects the heart muscles. Moving towards the morphology. The heart findings depends on the disease process ranging from myocardial infarction to stenosis or regurgitation. If there is accumulation of blood in the left ventricle, it will lead to accumulation of the blood in left atrium as well. That is, impaired left ventricular function causes secondary dilation of left atrium, which increases the risk of atrial fibrillation. We know that the left atrium receives blood from the lungs. So if there is blood accumulation in the left atrium, it will lead to blood accumulation in the lungs as well, which will cause pulmonary congestion and edema that will produce heavy and boggy lungs, or say heavy and wet lungs. So in the lung findings, we can observe some mildest to most severe pulmonary changes, including perivascular and interstitial edema, particularly in the interlobular septa. As here you can notice the thickening of interlobular septa, which is responsible for Kerley B and C lines on the chest X-ray study. And here we can also find progressive edematous widening in the alveolar septa due to edema, and accumulation of edema fluid in alveolar spaces. In this morphological picture of alveoli, we can notice that there is fluid or blood accumulation, and the hemoglobin released from here will be stored in the form of hemosiderin. This hemosiderin acts as food for macrophages, which will attract the macrophages to the alveoli, called the hemosiderin-laden macrophages, also known as heart failure cells. Moving towards the symptoms. Now we know that left-sided heart failure leads to congestion of lungs. Therefore, the patient will find it difficult to breathe. That is, he'll suffer from dyspnea or shortness of breath. As the disease progresses over time, the patient will suffer from orthopnea. That is, when you find it harder to breathe when in supine position. And in severe cases, patient will suffer from paroxysmal nocturnal dyspnea. This dyspnea usually occurring at night, and it is so severe that it induces a feeling of suffocation. Thanks for watching. Don't forget to like and subscribe and share with your friends.